Let us protect children during COVID-19 and beyond. This is the Child Protection Week campaign theme for this year. And launching the campaign yesterday, Social Development Minister Lindiwe Zulu called on all sectors of society to unite and recommit themselves to strive for what is best for the children of South Africa. But for more on this, we bring in Dr Shaheda Omar, who's director at the Teddy Bear Foundation, and Ricki Fransman, who's director of Childline South Africa in the Western Cape. Ladies, thank you so much for joining us on this very difficult and important conversation this morning. I think, Dr. Omar, let me start with you. Child Protection Week and where we sit. I mean, just to start off with where we're ranging right now on a scale of 1 to 10 and how well we're doing in protecting our children and if we're getting any better as a country. Let's start there to set the scene for us.
So thank you for that and good morning to everybody. If we cast our minds to 1997, when the whole campaign of Child Protection Week was initiated, and we're now in 2023, where we continue to see the brutalization, the violation, the neglect, the exploitation, children dying every day, children missing, children being subjected to kidnapping, abductions, children being used for murders. I mean, these are not things that we are not seeing. I think these are incidences that are on the increase. So if we look at this period, what have we achieved and what is it that we are lacking? I think that those are the key questions that we need to visit and, of course, address urgently, because I agree completely with the Minister of DST, Honorable Lindiwe Zulu, that we need to work collectively, we need to be in collaboration with each other. It's a systemic challenge, and of course, collective efforts are definitely needed. However, you know, what is a child's right? Every child's right, it's not only about mandating and regulations that should speak to their protection, but it should be an implicit right. And we see that on a daily basis, 3 children go missing, 5 children are subjected to abuse, and these are the cases that we are faced with. Children are even deprived of food security. So if we look at the basic rights, are we meeting the basic rights of children? The right to education, the right to healthcare, the right to food, you know, and of course, if we look at the load shedding as well, impacting on the mental health of children, these are things that are not always overt and invisible, but psychologically and long-term implications has, you know, a lot in terms of children's well-being that we need to address immediately and urgently.
Yeah, I think, you know, you just looking at the various examples that you've made there, Dr. Omar, very concerning, because one could argue that within just the past month, we've seen those stories make headlines of children murdered for muti use. And then you've talked about food security for children, where we know that in some schools, food simply has not been provided to so many children. So there's so much to look at. But Ricki, I want to bring you in here. When you look at the work that you do with Childline, this is supposed to be the platform that children call when they are in distress. When you look at some of the cases we've talked about, it is in areas that children most trust that they are not well taken care of. So let's talk about that. Where are our children most vulnerable?
So we're actually finding that a number of our children, most of our children are vulnerable within the family system and within the immediate communities, as Dr. Omar mentioned earlier. The level of violence that children are exposed to, not just within the community, but within the home, is having a serious impact. So we often have children who phone in on the line, who are just needing to engage with somebody, sometimes at a time while violence is happening in the home. And so they just need to be able to reach out, you know, and speak to a counselor or to engage with somebody because they are feeling very unsafe. And so we not only see that through our helpline, our toll-free helpline, where children can phone, and that number is an easy number to remember, it's 116, but we're seeing it across all our programs nationally in the organization. And so children are really feeling very vulnerable in these very spaces where they should be feeling safest.
Yeah, I wonder, Dr. Omar, if the work that we're doing to protect children really is reactive and not necessarily proactive, right? Where we're saying that we certainly are educating children about where they go when they don't feel safe. But are we having that kind of conversation within our own communities about families and communities needing to protect their children before something happens, Dr. Omar?
So again, if we cast our minds to 20 years, I think there's been a lot of progress made in relation to awareness raising and, of course, access and availability to platforms and resources, and the Gender-Based Violence Command Center, Childline. These are facilities that children have easy access. And of course, if we look at our SAFE programs, the outreach programs within the schools, that there are opportunities created for children to learn about their rights, responsibilities, and where to report, how to report. But again, we need to be realistic here. The hardest hit areas are the rural areas. And I think my colleague from Childline would certainly agree that access and availability to resources are usually far and few between. Access to healthcare facilities, for counseling, for any kind of immediate support. First responders are not easily accessible. So whilst we've made a lot of progress in terms of reaching out to learners, to communities, to families, to parents. If we look at positive parenting, it's certainly become something that has become part of interventions within the school structure, within the faith-based organizations, and even other community-based organizations. And if we look at sexual reproductive health and rights, something that the Teddy Bear Foundation has aggressively now embarked on, having leadership clubs for both girls and boys, including the boy child. Previously, it was only girls included in the sexual violence initiative programs. However, we've realized that boys have been excluded for far too long and have a huge role and significant role to play in solutions and in, of course, engaging in analyzing values and attitudes around toxic masculinity, patriarchy. So certainly taking ownership and driving this process and developing and instilling empathy, which we think is critical. So a lot more work is being done addressing the masculinities and how best to address this violence that we are faced with. We're working a lot with child pregnancies, and we at the Teddy Bear Foundation do not speak to teen pregnancies. A 10-year-old, a 12-year-old is not a teenager. They are children birthing children. And these are things that we are working with intensely with many disadvantaged communities. And this is where the challenge is, that the disadvantaged communities continue to suffer. And that is where all efforts need to be channeled towards.
I think there's something to be said about the language that is used, particularly in our homes, around children's rights. I mean, you'll find a lot of parents saying, well, these kids have rights now, but there's a negative tone to it, and something definitely that needs to be a bigger discussion. But I want to look at this theme quickly. Let us protect children during COVID-19 and beyond, the theme for Child Protection Week, Ricki. And I'm wondering what your thoughts are in what we're hearing from even the KwaZulu-Natal Department of Health, saying that they've noted a sharp decline in child immunization since the outbreak of COVID-19. I mean, there's the basic the basic right to health, right?
That's right. Speaking very broadly, we obviously definitely support the need for children to be vaccinated, because we know, and there's evidence how that provides safety for children from a health perspective. But it's understandable, I would imagine, that vaccination rates may have dropped given the nature of, the COVID pandemic and the impact that it had and just how it affected everybody. And unfortunately, our children, being children, were the most vulnerable. And so now we are seeing the impact of that, as we are moving out of the pandemic, we're seeing the impact of that. And we really need to come together, work together to address, the impact of the pandemic, with particular reference now to vaccinations. It's also just to say that, we talk about Child Protection Week, we implement activities around it, but the responsibility of protecting children, it's not children's responsibility. It's the responsibility of adults, caregivers, communities, and us working collaboratively, both as government and as the civil society sector. That's the only way we'll create effective change. We have wonderful legislation that speaks to the rights and responsibilities of children, speaks to protecting children. But when it comes to the implementation, we really do need to work together.
Yeah, not just government and civil society, but our very own communities as well. A reminder for us all to be active citizens and ensure that even the child next door is safe. Thank you so much to our guests. Dr. Shaheda Omar, the director of the Teddy Bear Foundation, as well as Ricki Fransman, director of Childline South Africa. An ongoing discussion, and we certainly will be having it throughout the week as well.